gonna get going here. If we could start to get folks to settle in. Uh, we'll give it about one more minute and let our panelists join us in a second. Huh?
Here I is.
There you are.
The way our names are.
They're perfect.
Very good. This is yours, right?
Oh, no, but I'm actually going to take that since I think you're. I didn't realize that you were with Domestic Workers in Action.
Yes.
Oh, awesome.
So I'm going to do my presentation with my back turned to the audience. You can see my sign.
That's awesome.
I participated in a protest they had over at Senator Cornyn's, in front of Senator Cornyn's office, about not cutting Medicare, not cutting Social Security. I can tell her, Grandma's on the picket line.
Mm-hmm.
That's me.
That's awesome.
I used the gray hair to my advantage. I adjusted my slides, so my presentation will be briefer.
Yeah, I'm going to move through some of mine too.
I went
Just
in
because
there.
people are like,
So
you're done for the day, you know.
It's okay. You know, we're the last. Close it off with a bang.
Okay, folks. I hope that y'all enjoyed your lunch. And I want to mention that we have one of our panelists was feeling ill and appeared to have a fever, so she had to go see a physician. And she was our dreamer. And in either case, I'd like for us to continue, and we have another important piece. And I do want to mention, following a little Q&A after our panel, that we want to have a little bit more discussion at the end, just in terms at minimum to go around the table before we finish our afternoon, to ask a question about what's next. But we'll get to that. We won't be breaking up into groups and things like that, but there are a few things that I'd like to ask your recommendations and advice on as to a follow-up, and we'll leave that for a little later. I do want to introduce, as I have this morning, is our facilitators, and certainly she's a key member of our staff at Lafayette, and I remember interviewing Amy the corner restaurant I eat from our office. And so we've started this organization together. And so you never want to leave out your staff who do a lot of your work and keep you on your toes, to say the least. And Amy's originally from Oregon, and she very active in immigrant rights issues, in organizing, and she came from that history. And of the truth be known, even though we were in large part started a little bit as a health organization, I was more interested in individuals who were really more on the ground working with people, who really could connect the values and the principles and the needs in our community to policy, and that was more critical. So she came with that. And having said that, she's, I'm biased because she's also an alumnus of the same graduate school that I went to, and that's the University of Washington, Seattle. She got her master's in public administration from there. So let me have Amy come on board and facilitate this next session.
Thank you. Before we get started, yesterday we had a really great opportunity to connect with a lot of individuals, and one of our really important things for us was to have an opportunity to tell stories. And we really wanted to set the stage for this discussion today by having someone come up, and that's Noe Ramirez of the Living Hope Wheelchair Association, to tell his story that will help us guide our conversations for this panel.
Sí, lo voy a decir en español, creo que muchos hablan de aquí español. Bueno, este es un curso que nos ha ayudado bastante, ya que la asociación a la que yo pertenezco somos todos discapacitados. La asociación se llama Living Hope Wheelchair Association. Somos un grupo de alrededor de 50 personas, todos con lesión en la columna vertebral, algunos por accidentes, otros por enfermedades, algunos fueron víctimas de crimen. Entonces, esto del programa de salud como que nos viene a nosotros, pero como anillo al dedo. Se ha hablado mucho de tantas cosas, ¿verdad?, de los hispanos y de todo, pero vamos más allá de lo que es realmente la gente que no tiene un seguro médico. En nuestra agrupación, todos los que estamos no tenemos un seguro médico, pero nos defendemos, hacemos car wash o hacemos rifas, hacemos muchas cosas al principio empezamos nada más para nosotros, ahorita ya gracias a Dios repartimos supplies para cualquier persona que lo necesite, el segundo miércoles de cada mes. Entonces a lo que iba yo, que estos cursos sirven bastante para que nosotros nos pongamos a pensar realmente, impulsar más estos seguros médicos que se impartan para todas las personas, no nada más para aquellas que tengan documentos en este país, sino que se amplíe, ¿verdad? Que luchemos todos fuerte para que estos seguros médicos incluyan a todos, no nada más a unas cuantas personas. Hay mucha gente que trabajamos aquí en este país muchos años, por no tener un estatus legal, para nosotros no hay nada. Entonces es difícil y pues yo lo que les quiero lo que les quiero pedir es que impulsemos, ¿verdad?, que apoyemos un DREAM Act, que apoyemos una reforma migratoria y que apoyemos también a que toda la gente sea incluida en esta cobertura médica, que sea para todos. ¿Ok? Bueno, que Dios los bendiga y muchas gracias.
Gracias. I wanted to lead this session with Living Hope telling their story, because I think that's really what the essence of what I really wanted to get out of this panel discussion. As Juan had mentioned, sadly, Nancy Juro felt ill today and had to go to the doctor, so is not able to be here. But at the same time, we're going to have a really great discussion with our two panelists that are here. And so let me just begin by introducing her. So we have today Jennifer Nanu, a Director of Health and Civil Rights Policy Project at the National Council of La Raza. For 8 years, she has overseen efforts of the Health Policy Project aimed to improve the health status and outcome of Latinos through policy change. Ms. Nanu led NCLR's organizational efforts to insert Latino priorities into historic to the historic Affordable Care Act. Her work on collective efforts to enact a major children's health initiative led to the restoration of critical benefits for legal immigrant children and their families. She's received recognition for her work to eliminate racial and ethnic health disparities, and when she was presented at the 2008 Congressional Black Caucus Health Brain Trust Leadership Award in advocacy. Erisima, I'm going to pronounce your name wrong, but I'm sorry. Iracema, perdón. Cavazos is the president of the Domestic Workers in Action of San Antonio, Local 10 of Southwest Workers Union. The Southwest Workers Union has been organizing school workers for just shy of 25 years, while the Domestic Workers in Action have been organizing nannies, housekeepers, home care workers for just about 2 years. The Southwest Workers advocates for the community with the emphasis on workers, youth, and environmental justice. And with that, I'm going to go to our first panelist. And
good afternoon. All right, so I must too apologize to the interpreters. I am naturally soft-spoken, and so you're probably gonna have to do a lot of this, but I think of it as raising the roof, so just keep on doing it. You know, there's been a lot today about sort of building the power base for Latinos and making sure that we're at the decision-making table, not on the table for those decisions. And so the one thing that I want to do is make sure that we start a panel that can be particularly tough, a panel where we are often talking about folks who have either are going to have the hardest barriers to healthcare or who have been excluded, and say something about sort of the Latino power base that I hope you'll take away. And that's that they need us, they need Latinos. And if there's any message that we should start with, that's the message that we should start with. Because in order for the Affordable Care Act to be successful, especially at the national level, they need Latinos. And so they need to be accountable to making the systems work for Latinos, and that includes the ones that they have tried to politically marginalize, including immigrant families. And so I hope that as people think about that, they think about that power and lead with that message. This is one of my stories. The day that the Affordable Care Act was passing in Congress, there was one of the largest immigration marches happening in DC in the past couple of years. And here was this little boy who said, "We are a country made solemnly from immigrants." He was telling the story of the communities around our country, and yet on that very same day, there were things coming into place where we don't know whether his family was going to be included in the Affordable Care Act. And so I was wondering if he was actually going to get the health care that he needs because of the Affordable Care Act. I know that there are a lot of questions about the eligibility of immigrants. I'll answer as many as I can. I'll stick around. But this is going to be sort of a crash course, I think, in immigrant eligibility and the access opportunities. But I want you to take away one thing, which is despite the fact that there are challenges, there are also incredible opportunities for access. A lot of them are hidden and buried in the Act, and we must fight for those as much as we are fighting for those who are left out. So folks have talked about the three major pathways to coverage all day. They've talked about the new health insurance marketplaces, the exchanges. We've talked about the importance of the Medicaid expansion that's expected to bring coverage to more than 3 million Latinos around the country. But one thing that has sort of been talked about a little bit, but not much, is employer-sponsored coverage, and the fact that that too will be improved through the Affordable Care Act. I bring this up because this is a major channel for immigrants, and the fact is that employers with more than 50 employees will be responsible for providing insurance options for their workers, and their workers can also get coverage for their families. So we need to look at that as an opportunity. If you look at immigrant health care, there's a few things to think about. There's the group of lawfully present immigrants now through the Affordable Care Act who now have access to new forms of coverage. Employer-based coverage, as I mentioned, remains unrestricted. It's never been restricted, and so if your employer offers coverage, they're supposed to offer it equally to all full-time employees. That should be an option. The new health insurance marketplaces, the exchanges, are available to all who are defined as lawfully present. I'm going to talk about a recent exception to that. Those include protections for low-income immigrants in Medicaid. I think Ann Dunkelberg was the one who mentioned earlier that immigrant adults in the state of Texas do not receive access to Medicaid at all. If they are low income, they will actually have access. And that is actually going to be, and they qualify for Medicaid and they're in that income spectrum, they will actually have access to the exchanges. That is one key exception that people don't know about, and that's really important to fight for. Medicaid is unchanged with continued legal immigrant restrictions around the country. That's at least a 5-year bar to Medicaid, but again, in the state of Texas. Emergency Medicaid is available. For the undocumented, it's really important to understand there are real opportunities actually for coverage, but there are some real setbacks as well. Employer-sponsored insurance and private market coverage outside of health insurance exchanges, which technically can still exist, there's no explicit bans to that. That means if you have a worker and their spouse is undocumented or their child is undocumented and they are able to receive coverage for their family through work, there are no restrictions to that coverage. We really need to make that apparent to folks and protect that, because there's at least 3 million undocumented immigrants around this country who receive coverage through workers and their employers, and there's potential for more as we see the Affordable Care Act makes more employers accountable. The new health insurance marketplaces are restricted to individuals. But here's one key catch that many people don't know about. I'm often the first person to tell people about this. The small business exchanges that were talked about earlier by the Children's Defense Fund, they are not restricted to undocumented immigrants. So if a small business chooses to participate in them and they have somehow employees who are undocumented, they will be able to get access through that coverage. So I think if through these small business health insurance exchanges, there were no restrictions written into the law. And the reason why most people don't know about this is because when everything was going down with immigrants politically, there were people fighting behind the scenes to try and create these little carve-outs to protect folks. As is known, Medicaid, there's an explicit bar from full scope Medicaid, both at the federal and state level. And emergency Medicaid is available to those who would otherwise qualify. That is a big access channel for emergency care and urgent care. And I do want to point that out because those single childless adults or those single males that folks were talking about, they will have that access and opportunity if Texas decides to take up the Medicaid expansion. I did want to talk a little bit about farm workers. Their circumstances are unique. Farm workers still have the same opportunities through their employers to get coverage if the coverage is offered, but their employers can sort of have some tricks around sort of that responsibility. They only have to count the amount of employees who work 120 days or more if they're seasonal workers. So it means to get to 50, you need at least 50 employees who work 120 days or more. And so, that's the one thing that I would point out is that it's going to be harder for farm workers to get health coverage. So with that said, there are a number of alternatives on the table. I've already talked about emergency Medicaid. There's another program called the Basic Health Plan. that states can choose to take up. Again, this is something that your governor would probably have to act on, but it allows low-income individuals, if your state chooses it, instead of going into the exchange, low-income individuals can go into this, and they are able to lower the costs of co-pays and things like that to increase the affordability for certain individuals. This is also something that could apply to sort of legal immigrants facing the 5-year bar. There's community health centers, and as that said, there was a big investment through the Affordable Care Act for community health centers. But one thing to keep in mind is that community health centers are supposed to be access channels for everyone. There's charity care. There are new rules in the healthcare law that say, that start to make hospitals and private entities who say they're providing charity care be more transparent about that means. A lot of people's typical story is that they get emergency care, they're given a $20,000 bill. After they go through the bankruptcy process, they end up, then the hospital says, oh, we'll give you charity care. So they've destroyed their credit, et cetera. This is now saying that in line with sort of hospitals saying that they're providing charity care or providing community good, they have to be more transparent about that process is, so that the federal government can evaluate what their community good is. And then finally, there are state-funded programs, and in Texas, as mentioned, legal immigrant children can get access. So what's next? I'll go through this quickly, but I want people to keep 3 different sort of big public dialogues at the national level on their radar. States now take the front seat in the Affordable Care Act fight. You know, the Supreme Court's made its decision. There's going to be a lot of rules from the federal government about how to do this. There's 6 rules released in the past month, but the states really take the reins from here and make the decisions. There's a federal budget fight that does have deep implications for healthcare programs, and then there's national immigration reform. This is a quick timeline about ACA implementation timelines. As was said today, you know, the exchange deadline is today. I'm not going to tell you. I'm not going to tell you any more than what others have said today, which is, other than call Governor Perry and tell him what you want in terms of your healthcare system, because we need to raise the drumbeat to do that. And you know, I think 20 other people have already said that to you. States can expand Medicaid now if they want and start getting dollars, but their match dollars that people have been talking about aren't as generous as when they moved to 2014 and they get 100% for at least the first 3 years of the costs. And then open enrollment for exchanges begins October 1st, 2013. And I just want to put that out there because if you're thinking about organizing, if you're thinking about getting people ready, if you're thinking about public outcry, that's a key date to think about. So the healthcare and the budget, a lot of what folks are talking about in the budget may not seem like it's relevant to immigrants' access to healthcare, but I do want to point it out because the last time we had a serious budget debate in 1996, when welfare reform came down, 40% of the cuts that were made on the backs of immigrants. They need us. We can't have that happen again. And so it's critical to get involved with the healthcare fight and really understand what this is about. It's a fight about values, and there's questions about what that balance of those values will be. Will we have a fair tax system, or will we have a system that, will we have a fair tax system, or will we have a system that really just focuses on cutting from those who are most vulnerable, working families, et cetera. Right now, the conversation, as you probably know, is about will we raise tax cuts for the wealthiest among us? Will we close corporate tax loopholes? Or will we make cuts to things like Medicaid, discretionary funds, and by that I mean things like community health centers, which we've just said we need for communities? Will we preserve tax credits like the child tax credit and the earned income tax credit for those who are low income. These are just some, I won't go through this, but this is the jargon around the Medicaid fight in particular. And these are the types of proposals that are on the table. So healthcare and immigration. I bring this up because the administration, during the fight on healthcare reform, told immigrant healthcare advocates that they'd fix the challenges of the undocumented in immigration reform. Certainly, some of us suspect that they were trying to kick the can down the road. They knew that we were furious about that. And so they wanted to say, we'll get to it later. Well, now, with an engaged electorate, really recognizing the changing demographics of the Latino community, you're starting to see more commitments towards immigration reform. And they have an opportunity to fix this for immigrant communities. What is scary is that they, in an early decision, in a proactive decision, they have excluded immigrants from healthcare in something that would be considered an immigration gesture. In August, everybody knows about the big announcement of deferred action for childhood arrivals, which allows people who are essentially dreamers to gain access to healthcare. To gain access to immigration relief. Those individuals, just by the very definition, were actually lawfully present and could get everything from day one through the Affordable Care Act that a legal immigrant could get. 2 months later, thinking it was a little too political, the administration said, you know what, we're going to change the rules. And this isn't really real immigration, so we're going to change the rules and exclude folks from the Affordable Care Act. They did this despite the fact that people who otherwise have deferred action get the Affordable Care Act. So no matter what they say, there's a question of sort of what they're doing. People in the same exact category who are lawfully present. They're starting to categorize deferred action individuals as undocumented for purposes of healthcare only. And it's causing all sorts of problems in terms of governors like Governor Napolitano saying, well, the administration says they're not eligible for healthcare, so why should I give them driver's licenses? Or I'm going to go ahead and restrict other benefits. So it's a real concern, but it also sets the stage poorly for national immigration reform. On the other hand, the economics of immigration reform are challenging, and we won't deny that. Providing healthcare to immigrants costs less, but it still takes money. And the only way that sort of the budget works in DC is that they call it costing money, even though there's probably lots of preventive care and cost savings that come from providing immigrants health care. So we do have that challenge. So with that in mind, I just want to leave people with some actions and some things that they can be thinking about. First of all, you really need to talk about the Medicaid program and why it's needed. I know that I've said that immigrants face restrictions, but it's still a critically important piece of the puzzle. And the fact is, if we see cuts to Medicaid, we could also see threats to immigrant-related programs. If they cut Medicaid for citizens, they're certainly going to think about cutting the state-funded programs that they have, or the partially funded state programs for immigrant families. I really think you should think about who are the coalitions that you're building. Building alliances with healthcare providers. Everybody's talked about small businesses, but I also think it's big employers who would benefit from employees and patients with healthcare, and who could push for big expansions of healthcare. Collecting stories to illustrate opportunities and challenges of the system. This is really important for immigrants, and in a different way. One, because we need to show exactly what's happening out there, but we also need to show the challenges and really personalize and humanize experiences of immigrant families who often, and shift the narrative, and shift the narrative around their voices. And then I would just say, think about submitting comments on all these different rules. It's a lot of jargon, but all it takes is a letter. And we can walk you through that process, and I'm happy to give you some ideas. There are 3 easy actions that I'd ask that you take today. One is call your legislator today, and I actually need to shift this a little because there was a letter for federal legislators to sign on to call for the overturning of this DACA healthcare ban. It was initiated by the Quad Caucus, which is the Congressional Hispanic Caucus, the Congressional Asian Pacific American Caucus, and the Congressional Black Caucus, as well as the Progressive Caucus, in the federal legislature to say we need to eliminate this DACA healthcare ban. It's not good for healthcare, but it's also not good for what we need to do with immigration reform. So call them and ask them what they did on that letter. There were a lot of folks in the Texas delegation, folks you would think would be representing you, who did not sign on to that letter. You know, just to call out one, Representative Hinojosa was a big surprise. We proactively reached out to him. And so why are they not being accountable to that and making sure that they set the right precedent? Share your stories about what works and what doesn't. And then finally, I just say challenge the myths about immigrants and help reshape the narrative. There's a lot of negativity around immigrants, and we've all heard it, right? But the fact is, I like to say, undocumented immigrants are a dream for insurance companies. They want them all in. And based on sort of what Dr. Steins was saying this morning, they want them all in because of the community, the community's health, and their general well-being. They maximize the profits when they get communities like this into the pool. And so we need to start reshaping that narrative, taking ownership of it, and pushing back on what people say. So thanks. The one thing that I'll say is that my colleague Steffi Castillo is here from NCLR. If you want to share your story, she has a little video camera. You can share it today. We will send it back to you. We will also give it to LaFay so they can use that story, because we want to take those stories around and back to folks so they really hear what's going on. Thank you. There's my contact information. Oh, and there's lots of information on the back table, including my slides.
Well, good afternoon, everybody.
Good afternoon.
My name is Iracema Cavazos. Iracema is a hard name to remember, but if you see it over here, friend me on Facebook. There's not that many of us out there. Okay. I am president of the Domestic Workers in Action here in San Antonio. We represent nannies, house cleaners, and those are individual homes, not the ones that work at the hotels that you've seen with Mitia events. The people that do elder care, for instance, in private homes, not through agencies and so forth. We represent those people. So how do you organize these people, right? Individual homes and all? Well, we're doing it, okay? Most of these women that do this type of work are immigrant women, some of them documented and some of them undocumented. And how does this Affordable Care Act affect them? Well, as we have heard, the undocumented parents with US-born children are excluded from any of these benefits that are being offered. There is, let me get this thing up. So they are excluded. There is something we found out that here, Bexar County does have coverage, do help immigrants that do not have documents. So they collect funds in hospital districts to cover undocumented individuals, sort of a tax we pay countywide. To access these funds, now these funds are underutilized because it's like a well-kept secret People don't know about it until you're in the emergency room, and then finally somehow they find that there are funds, but sometimes it's a little too late. Those living outside these hospital districts remain uncovered, so they do not have access to this. But here in San Antonio, there are a lot of hospitals. We know this. So here in Bexar County does have this. And I'm going to tell you about a domestic worker and her story. These are real lives. When we talk about numbers, we saw a lot of numbers here, a lot of charts and graphs, and arrows going this way and that, and lots of dates. But these are real people being affected. I'm going to tell you about Yolanda. Yolanda was a domestic worker, undocumented. She was working with this family for 7 years. She had US-born children who were covered through Medicaid, okay? She was raising these children on poverty wages. She fell seriously ill the last 2 years of her employment. She postponed seeing a doctor. She didn't have funds, and mostly she didn't have time because she could not miss work. Poverty wages makes you work as long as possible because this is how you feed your family, especially if you're undocumented and don't have access to a lot of programs. And those programs that you do have access to, you have to form a line and miss work, which again is a negative. So she postponed seeing the doctor until she passed out at work because she couldn't, the body can only give so much. Now she had time and she could see the doctor. So she went to see the doctor and she had breast cancer, untreatable. She died last year, leaving her 4 children in foster care now. These are real lives, people that are affected, real children that are among us, going to school with our children, that are now without a parent. The barriers to behaving in a humanitarian way, the opposition to extending Medicaid coverage to parents with US-born children. We need to change that. There are logical reasons for this extension. These children need their parents, just like our children need us. They lose the parent in an avoidable situation just because we do not want to be humanitarian about things. These children no longer have the financial support of that parent. Now they need even further help from the government, so they become a bigger weight on the government. So even the family for which she worked for was affected by her absence. Now they had to take time off because there was no one to take care of their children. They missed work, okay? Their tax base, lots of things. It's a domino effect because we depend on these people. Domestic workers, if you don't have someone that you can trust your children to, your home to, your elderly to, what will happen? Can you show up to the office with your children in tow? With your parents who have Alzheimer's? Who's going to take care of them? We depend on these workers, okay? So we need these people, and they need us, and they need for us to have a humanitarian attitude. So what we would like to do is, of course, to expand Medicaid to cover undocumented parents of US-born children so they can continue to care for their children. Who best to take care of their children than the parents? Lacking that, we could expand Medicaid to the federal standards in opposition to Rick Perry and the Republican efforts to resistance. We could give publicity to existing programs like the Bexar County Hospital District Medicaid, I'll call it that, I'm not sure if that's the official name, Support the county efforts to bypass Rick Perry's block to the extension of Medicaid proposed by the federal government in the Affordable Care Act by changing the county programs to pick up the federal approvals the states are fighting, the state is fighting. So that's what we could do. I am union, okay? So I would say that the first goal is to improve the earning power of the working poor so they can afford the basics without assistance. I have mentioned to some people, do you hire a domestic worker? And they say, no, I can do it myself. Well, if you have the financial ability, why not hire a domestic worker? Give her the dignity of working instead of having to stand in line for social services. If you're able to provide a dignified job for somebody instead of having them get in line for services, a handout. They are people with pride, and that also is a contributing factor for why they do not fall in line for these programs. Now, if we extend the Medicaid to documented individuals, that will free up charity funds for those that are undocumented. So we can also work towards that. Our goal regarding the Affordable Care Act and the poor in our community should then be to have Texas expand the Medicaid program. We should also promote and support the Bexar County and other county efforts to do what the states will not. So expanding the Medicaid coverage for undocumented parents of US-born children so they can continue to care for their children. Thank you.
Thank you to our panel. I mean, I think I have a few comments and just a couple questions to our panel to help us, and then we'll open it up for discussion. In the state of Texas, about 1/3 of mixed status families live amongst us. And so the question of how and who gets service through the Affordable Care Act is really a critical question. And how we think about it and the strategies we put towards it are going to be very, very important. You know, as Jennifer mentioned, you know, the fact that, you know, under the new Dreamer executive order, the exclusion under that provision to not include Dreamers under the Affordable Care Act basically puts them once again at their inability to access health care. And that is a very sad state of affairs, especially given when they initially was introduced, were a part of the process and no longer. But that also opens the door for many strategic opportunities and alliances. And if that is, you know, what can reproductive health and women's health advocates work with Dreamers more concretely as an opportunity to fight for access? What is it that we can do collectively to ensure that our complete access to our whole family, regardless of legal status? What are some alternatives? Other states have, you know, created state funds to cover undocumented. Obviously, the state of Texas itself has been very limited in its scope, let alone for adults, and let alone for immigrants. And we need to be thinking outside of our own reference, in our own frame and box, as they say, to think about what we can be doing. Because, you know, we often talk at our work about our bienestar, and our bienestar is just not about our health. It's about, you know, access to a living, dignified wage. You know, it's worker rights. It's access to health care, but affordable health care. That's quality. It's also about, you know, being able to live in an environment that isn't polluted. These issues are very diverse and complex, but so are our communities. And I just kind of wanted to say that I think that the suggestions and recommendations that Jennifer presented around, you know, calling our legislators specifically, you know, our local ones, that means if for those of you in Bexar County, that, you know, if it's Gonzalez and a variety of others, to push their colleagues to be able to support to get the Dreamers back onto the ACA. It's really important for us to start pushing our legislators. But I wanted to present. I wanted to ask the panel to ask them if they can think of other strategic opportunities and intersections that we think that we could work collaboratively to really push this agenda forward.
As I mentioned, friend me on Facebook. I get a lot of suggestions to sign petitions, to send letters. Our organization, through the National Domestic Workers Alliance, we got children to write thousands and thousands of letters to the politicians about not separating families, the deportation issue. So that's a movement. See, we can do this. And we gathered here in just our little city with children's access, hundreds of letters. So we can do and make an impact. And they delivered, think about 90,000 letters to the Congress. If children can do that, we can do it too. We can make phone calls, we can write emails, we can send texts. If we get the phone numbers, which are being shared all around, and make a chain and spread the word. Always pass it on, share it, and get somebody else to make a phone call, to write a letter, to send an email, to pressure people, let them know where we stand. If they listen to us, where we stand is important. They need to know. We need to pressure them.
So I'll just mention, there were 90 members who received those letters. 90 children who delivered those letters to Congress, I think, today. I just was pulling up that email. There's another collective effort coming up for this Tuesday. A number of organizations at this table, specifically related to the DACA healthcare ban, are coming together to do a national call-in day to Congress and to the White House. Its first focus, it's the National Latina Institute for Reproductive Health, it's National Immigration Law Center. We're all spreading the word and saying we have to overturn this. This is the first gesture that needs to be done with respect to paving the way for healthcare for all. One of the things I think is that people really did see power in this election, or saw something different in this election around Latinos. And from that perspective, they're sort of willing to say, okay, we have to respond to this. But how they respond, and whether it's symbolic or not, I think is very important. There's plenty of people who are going to make gestures. But when they say immigrants deserve to be fully integrated into this country, when they say Dreamers deserve their pathway to legalization, do they really mean it? And I think we have to start to call people to task. What is symbolic, and what is truly what we mean, what is truly meaningful to communities and actually helps them gain more power and ability just to take care of their families.
We have a question.
My name is Cecilia, and I work with Pfizer and our state government relations team. And I'm not speaking specifically to this immigrant issue, but just the issue at large of the Medicaid expansion in the state of Texas. One of the things that I think that we haven't really discussed in this room today is the fact that we have a very unique situation going on in our legislative session this upcoming year. We have about 2/3 of our entire legislative session is freshman or sophomore class legislators. We have an opportunity to educate our legislators on our issues. And I had a call this morning that I had to unfortunately step out of this presentation while they were talking about the Medicaid expansion. And one of the things that was discussed on that call with my team was an example of a situation where a candidate in Tennessee had run very adamantly about opposing the expansion in the state of Tennessee. And he was really wanting to make a mark and a name for himself, so he ran to file a bill on his position opposing the expansion of Medicaid. And then he got a visit from a hospital who is the largest employer in his district that educated him on what the expansion meant to his constituents, to his district, from an employer's perspective. And I think that that's another thing that I just wanted to share with everybody, is that we all know we live in Texas. We all know what the political environment is of this state. One of the things that we can do as a community at large to educate ourselves and to be more impactful in our efforts is to start speaking the language of the party that is holding the decisions. So if we start talking about our need or interest in expanding Medicaid in a way that is meaningful to a Republican Party, whether it be from an employer standpoint, a cost standpoint, then we will have more, we will be heard rather than it just being a Latino issue, rather than it just being the right thing to do from a human cause standpoint. If we start addressing these issues in ways that are meaningful to a Republican Party, I think that we'll have a lot more impact in moving the agenda that we are looking to advance.
I think your point in particular around freshmen and legislators coming into Texas legislature is a really critical component, but I'd actually like to take a little pushback on that the idea of speaking to the language of the individuals and representatives in power. I think one of the mistakes that I felt we made during the 2011 session was to really whitewash a lot of our issues. And in that, we actually, in some cases, we legitimized the negative stereotypes and framing of our community. And that is not what we intend to do. We are not going to criminalize our own community. We're not going to not allow them to be undignified in a way. I think we need to lead in a way where, yes, we speak to the issues at hand, but at the same time, we need to remember that we value certain things, and that's the human dignity of people, and we can talk about it in a way with real stories so that we can make sure that that happens, because that's another key piece of this conversation. We need to make sure that we are thinking about all of those aspects, because what happens there gets trickled down to our community. And then when we talk about trying to organize and mobilize them, it's really challenging, because they're like, well, you're like them then. Well, no, we're not. And so we need to just be really keenly aware about, that's kind of why we had the conversation and we brought in Pedrico to talk about framing and messaging. And it was really for us to start thinking about that, because I think we do need to reclaim that space. We need to tell our own story and our own narrative in a way that is in a very dignified way. And I don't know if any of you have anything like to add to that.
Do we have any other questions from the audience?
Well, speaking of stories, I don't know if you, when you're watching a movie, sometimes you might see a character that you do not relate to, but as the story progresses, you start to root for this character. That's the moving effect that a story has. And yes, some people only understand figures and cold facts, but we need to always have that, also that punch, that these are lives. Yes, it's good business to have funding for our hospitals. Why not? Our hospitals serve our needs. So yes, the figures are great, but these are real people. So now look at how it affects Yolanda, how it affects, well, you've seen my sign on my back. We're having a benefit. Elderly worker, she's worked all her life. She's undocumented. She has nobody and nothing. So now we're running a benefit, because that's how we're gonna help her out. But again, real lives being affected, and sometimes they pay the highest price, and that can actually be immeasurable money-wise.
Good afternoon, everyone. My name is Celi Roy Cavazos. I represent migrant health promotion in the Rio Grande Valley. We have 5 national offices, and our Texas office is in Weslaco. To speak to what Amy was saying, you know, yesterday there was a conversation in the convening at 2 o'clock about the vote and all this jargon about Texas becoming a purple state. The fact is, ladies and gentlemen, is that Texas is indeed a blue state. And our vote does count. And there were testaments to that in this past election. A very good example is Senator Wendy Davis out of the Fort Worth area. You know, if you look at a race like that in an election like the one we just went through, we realize that we have the power in Texas to create system changes in all sectors of society. The thing is that people don't go out and vote, or people think that their vote doesn't count, or people think that Texas will be blue not till 2016 or 2020. But in fact, you know, I have the privilege of sitting on the Texas Democratic Executive Committee. I represent Democrats with disabilities across the state. And, you know, if you look at the numbers in the counties, and I'm blessed that I'm from the Rio Grande Valley, I come from a blue county, but we do have the power, and we are sitting, and us as community advocates, it is our duty to bring out the vote and to bring people to the table, to the decision-making table, and that we do hold our own identity, that we are the party that sees ourselves through the social lens of the ideals that the Democratic Party was founded on, is giving access to people who need it the most, and who fight for middle-class families, and who are advocates for education and healthcare. Not us seeing ourselves through social lenses that have only smashed us down in the past. We do have a voice, and we can be heard.
Any other questions? No other questions? Well, I'd just like to thank our panel. If you guys have any other last-minute thoughts or...
You know, I think that was the perfect ending, but I'll just say one thing. When I was saying reach out to employers, reach out to healthcare providers, one of the things that I didn't say is thinking about Latinos broadly. Some of the people who own the hospitals, some of the biggest hospital systems in Texas, are Latino owners of hospitals. They have the ability to go in there. People need to see Latinos in the diversity that they are within the state of Texas, and they need to hear all the stories, and that helps shift the power base, and that's all I would say, but I think the words were perfect.
Sí se puede.
Yes.
Thank you.
I'd like to ask the audience, you know, before, again, thank you, panel, very much, thank you. To ask the audience, in terms of just, as I mentioned earlier, we have everyone's email, all the folks that attended today, and we will provide some feedback to you guys. Also, we may do like a Survey Monkey, if y'all are familiar with that. All of you have an email where we'll ask you a little bit about what you thought. It won't be this big evaluation, 3 or 4 questions, but specifically, what are some things that you would like to do next, or information you would like that would help you, as well as connect you to some other resources. But we will be involved with these coalitions relative particularly to the Medicaid expansion, some of the issues discussed, and we're going to be asking you and reinforcing and reminding, ¿verdad?, to contact your representatives and things of that nature. I don't know if anyone has a particular follow-up kind of recommendation that you would just want to make. In other words, the question is, what do we do next? If you're asked that question, what would be your response to that question if you have a point you'd like to make about that? What to do next? Anyone? Yes, sir.
First of all, I think that the importance of making sure that a policy arm, whether it's La Fe Policy Center or a number of the other representatives that were here today, continue to be part of our plans, whether they're regional, local, because a lot of times we tackle things with emotion, and we form marches and we make signs, but you always have to couple that with a strong policy statement as to what is the solution to the protest and not just the protest. So one of the things that I think we should do differently and that we should do united is to share with Lafayette Policy Center or the representatives that are here any policy thoughts that you will have, because if you're like me, you're going to have the best policy thought as you're sitting in the plane going home. And put it on the table so that it can be circulated, because I think that's where we have lost the opportunity a lot of times to make a policy change. When we do all of the activity and we gather and we march and we bust people in, but we don't present it in the language and in the format of policy. And it's an individual step. Lafayette has always been at the forefront of organizing in different scenarios and different issues. And I think this is one issue where we will go back to El Paso and try to organize something that we can then tie to the other many movements that are here, because the voice needs to come from all sides of Texas and not just the urban or the rural or the immigrant. Todos tenemos que hablar, put our stories on the table and become united in order to have a real voice.
I mean, I think that Lafayette has made a commitment to really trying to be as strategic as possible to not only think about our policy work, but think about our policy work from how does it enhance current organizing that's happening. And that's always been something that's very important to myself, and try to be very strategic about that. And so that means that we, like Juan had said, you know, I had a conversation with someone from TOP over there asking, well, what's our next step? Are we going to get everybody's information? And you know, and I'm like, yes, that's really important. We want to create a community in which we can begin to exchange information, so that as you're thinking about, you know, oh, remember that barrier that happened in that policy when I was working with somebody, or what about this? You know, I think that's really important for us to create a community of discourse, because we totally realize that even us here in San Antonio cannot hop and go to Austin at an hour's notice when they say we're having a committee meeting now. We don't even have the money to do that. And so we have to find really creative ways to stay connected. And we were talking about Facebook and, you know, listservs and things of that sort. And we're really going to try to make that happen as well as with all our other partners who came along with this ride.
There's a question over there. Rachel.
I guess it's more of a comment and maybe a recommendation to consider. I know, Juan, that you and Lafayette are going to be working on what we do as a group here, but I would challenge each of us that when we're going back to our own communities, you know, we're going to be hearing perhaps in our communities where they're going to have, you know, Eagle Pass Day on the Hill in Austin, or Uvalde Day or El Paso Day or whatever. And a lot of times in some communities, it's a rather closed group about who goes. And I think if we're not already at the table back home in those groups, then we need to infiltrate that group, and we need to be there, and we need to push our agendas and have them support our agendas as much as we would support theirs. Because then, you know, then the voice gets louder, the voice gets bigger, and we sort of permeate to other advocacy groups that maybe aren't as vocal or as supportive of us right now, but because we haven't educated them. So it's on us. It's on us to go back home and bring more people in, and not just count on us by ourselves. Let's go get other partners that historically haven't been our partners.
Exactly. That's excellent. Yes.
One more question.
What I would also like to see is accountability on our part. I really like the idea of yesterday of developing a listserv, so that way we have someone that we can report our status back to, because that's important. It's one thing to leave here and say, we need you to do this, we need your help, and then when we get home and we don't do it. So I think we need to have accountability on our part as well.
Good point. Thank you. Exactly.
Anybody over here?
Where?
Anybody over here? I just was like motioning.
Lydia?
I didn't have the pleasure of being at your 2 o'clock meeting, so you may already have decided to do this, but I think it would be important for us 10 potential legislative bills that we put forth, even if we know they're not going to pass, and work at making sure that we pass those that we can at the state level as well as the congressional. And there's other suggestions, but I know that this is excellent. Thank you.
Thank you. Anybody else? You
well,
know,
see? Well, guys, you know, I know it's been a long day, and on the behalf of everyone that's contributed and making yesterday and today happen, we really appreciate you being here and taking this time and effort. And I think the suggestions here in just the last 5 minutes that were made are excellent, and we'll do our effort to do that, specifically our own accountability and saying we will do something when we get back home, whether that's friends or other organizations, regardless of where you are from the state. And we'll do our best to do the follow-through, and we'll stay in communications with you. I thank you. For those of you leaving town or just going down the street to go home, be safe, and gracias por todo.
thank you.
Thank you.
I just have a couple comments before we leave. On behalf of myself, I want to thank everyone who took the time once again to stay and to listen to this great information. I think it was like really critical, because for us to have a shared vision of where we're going, we have to know where we began, and this was just a start. So I hope that we can work with you and you will work with us so that we can begin to do some really great work during the legislative sessions.
Guys,
And
WW Now Cast. WW Now Cast.
we'll have the video on
This
there.
today has been televised, and you'll be able to view it and utilize it in however you want to utilize it.
Yeah.
Thank
And,
you.
and if you don't want to take your name tags, we will take them and recycle them. So, because you know we all have like 1,000 in our office.